in a non-stop train from Delhi to Dehradun. I was absorbed in a book called Man the Unknown, written by Dr. Alexis Carrel. Now, Man the Unknown, every medical student, you must read it. He is a Nobel laureate and also doctor. He has transformed into a philosopher. The book talks about how the human beings are not body alone. Mind and body is a combined package, that is physiology and psychology as an integrated package, but Dr. Alexis Carrel in 1950s announced most of the hospital they treat body, not the mind and body together. For that he got a Nobel Prize, 1950. So I was reading the book. I was absorbed in the book Man the Unknown, written by Dr. Alexis Carrel. There was a vacant seat next to me. Suddenly one passenger greeted me and he wanted to convey certain aspect. I asked him to sit by my side. He introduced himself and said he was working in the government office. His name is Mr. Jitis. Jitis said, Mr. Kalam, I want to thank you for giving me to the people like me a Raju Kalam stent, cardiac stent, which is fitted in two of my arteries. You know, two of my arteries fitted with a cardiac stent is called Raju Kalam stent, which is fitted to two of his arteries. I was fitted with these stents in Hyderabad hospital, almost at no cost, since at that time I could not afford a high cost imported stent. Thank you, sir. My family also would like to greet you. His lovely family with the kids were all in smiles. The stent emanated, the cardiac stent emanated through the working of missile laboratory and the medical institution on a mission mode. My friend Arun Tiwari, who was born here in Meerut, she is a professor, brought in together a team of cardiologists and metallurgical engineers to create the stent. It was a successful mission of using one's brain power to remove the pain of the others. I thought of sharing this incident with you to stress the importance of medical and engineering teams to work together for developing a medical system, devices, equipment at an affordable cost as a societal mission. And you can start, Meerut can be a good example, bringing the medical system with the community, academic community of engineers and medical students, researchers joining together. Medical costs are concerned both in developing and developed countries. How remarkable it will be if medical education technology division includes the mission of design and development of medical devices and medical equipment by harnessing the medical and engineering communities of the country, particularly the Meerut. You should think big and you can achieve it. Now friends, now let me visualize. There may be many hospitals, doctors will be here, private and corporate, public. Now let me visualize how a dynamic healthcare center or a hospital should be. IMA Meerut may like to facilitate such type of hospitals in the region. I have visualized of great healthcare centers. My visualization of great healthcare center based on I would have visited nearly 120 to 140 hospitals and medical colleges, and I have addressed them, talked to them, visited their laboratory, and similarly 50 hospitals abroad at various point of time, including Johns Hopkins. I have visited them. Now dear friends, I visualize the great healthcare center with the following characteristics. Number one, patient is the most important person in the hospital. When the patient enters the hospital, presents an angelic look, and all the team members of the hospital always wear smiles. It doesn't cost anything. Wear smiles. The patient feels that I am going to get cured. This is the number one. Number two, the hospital consumes less electricity and less water by adopting green building for all modernization tasks. The choice of the power source is solar and wind. The hospital, third one, the hospital premises are totally noise-free. All the test reports of the treatment schedule get attached to the database of a patient to the electronic medical record without the need of the patient or the relative to search for the reports. The database is updated or authenticated every hour. Now maintains the database of all the cases treated by the hospital in the past which are easily retrievable. Patient is not subject to diagnostic pain. Patient is not subjected to diagnostic pain. I hope doctors will understand. When a patient comes and he reports there's a problem and certain preliminary checks are done, then they give a requirement. The doctors, some doctors give a requirement like scanning, X-ray, a blood test, urinal test, so many tests they put it. So when he sees that when he go to the market to get tested for all, then he gets the pain, it is called diagnostic pain. It's an external induced pain. It's an external induced pain. I suppose at least the doctor, future doctor sitting upstairs, they will not introduce the diagnostic pain and also all of you. Okay. Now friends, the surrounding of the hospital are very important, are green with full of trees and with seasonal flowers and pleasant wall painting so that children be happy. Further expansion of the hospital is vertical mode, always hospital vertical mode, leading to a fast movement of the patient and doctors for medical treatment. There is no case of hospital-induced infection to the patient due to biocontamination. This is one of the serious problems in India now. The patient feels that is the best place to get treated. When he enters the medical institution or hospital, the patient feels that is the best place to get treated. The hospital is fully IT enabled, leading to virtual connectivity of the patient to the doctor, nurse and the chief of the hospital 24/7. Hospitals also networked with other hospitals, like-minded hospitals, nationally and internationally for seeking expert medical advice on unique cases. The daily medical conference attended by the chief of the hospital, doctors, nurses, paramedics and relatives of the patient. Sometimes the relative of the patient is a unique cases, reviews problem of the patient finding integration solution. This I saw it at Johns Hopkins Hospital at Baltimore, and during the doctors conference, some special cases they invite the patient's relative also tell the exact story. Friends, I would like to share with you, I have met two great doctors so far, and I thought of sharing with you what is the unique quality of two great doctors. Maybe a number of you will be here. If you send me a mail, I will add you also in my list. Now I would like to share with you the experience of two doctors who excelled in their profession and contributed in a big way to the society. I call it one person, lead kindly light. I have known Dr. G. Venkateswamy for over 3 decades. He is known for his silent contribution and bringing light to thousands of people. All his life he was worked for the total elimination of avoidable blindness. He has brought with the Aravind Eye Hospital in South the best of technology and management also. He has established a network of Aravind Hospital and also mobile clinics. He has created many leaders in the field who are spread various parts of the world. Whichever eye hospital I visited in India, I met a number of people who had been trained by Dr. G. Venkateswamy institution. It was amazing to see how even in his 80s he was radiating enthusiasm, perseverance for realizing his vision. Now Dr. Venkateswamy championed the community ophthalmology service in Tamil Nadu and surrounding region. I am a professor there, I am an honorary professor. This was a time when there was a tremendous amount of cataract backlog and there was not enough specialists. The mass movement for treatment of cataract shifted from improvised operating room to the hospital operating room facilities. Aravind has successfully integrated their core competence of community ophthalmology with modern medical treatment and research. Venkateswamy implemented the principle that Aravind Hospital must provide services to reach rich and poor alike. Yet, the eye care facility must be financially self-supporting. The entire Aravind eye care system is conducting an average 800 eye surgeries per day and annually treat over 2.5 million patients. They are providing for every 30 paid patients free treatment for 70%. That is 70% free and 30% of people they charge who cannot afford. These principles achieved through the high quality and large volume care and well recognized system. This one unique person I thought I must bring to your notice. And next person I call him reaching the unreached, because today lot of primary health centers we have in the country. Primary health centers, the doctors, 90% of the primary health centers in our country is not manned. The doctors are not there. Okay. Now, friends, in the present circumstances and environment in our country, it was inspiring to see how a doctor has put all his dreams in mainstreaming the tribal citizen of Karnataka for the last 25 years through Vivekananda Krijana Kalyan Kendra at BR Hills near Mysore. When I visited BR Hills in 1998 and subsequently 2006, I could see substantial development in that area. I could see a new tribal hospital, roads and education environment, and above all the earning capacity of the tribal citizen have been increased with the technology resource center as a base. Dr. Sudarshan H. Sudarshan is the inspiring architect of the societal transformation. The mission which he has started has spread to many parts of the country, including Andaman Nicobar Islands and Arunachal Pradesh. Dr. Sudarshan and his team have been selecting difficult regions and making a difference to the people of the region by their own way of life, which was started in a small hut. The nation needs thousands of Dr. Sudarshan for providing health care to our rural citizens. I am sure many doctors may emulate Dr. Sudarshan, young people, Sudarshan example in this noble mission. Friends, now I recently read a book I thought of sharing with you. Now friends, I was asking myself, is there any inputs and research which is coming from both physio, psycho and brain researchers because of the advent of neurosciences coupled with quantum theory? I have studied recently a book, The Secret Path by Paul Brunton. According to the author, now the conscience is explained significantly for the reason that the thinking process and biological process converge through quantum mechanics. He says that physics and biology are interlinked, that at atomic level matter does not even exist. It only has a tendency to exist. Now, recently, a friend of mine who is a scientist sent me a book, Biology of Beliefs by Dr. Bruce Lipton. The author is one of the greatest scientists in the bioscience, and after 20 years of research he attributes the origin of human disease and their cure have a basis on our intrinsic thinking and the relationship with our biocells. The book talks about a new approach which highlights the importance of what is called placebo effect and how it is actually powerful belief effect. The author says, doctors should not regard the power of belief as something inferior to the power of the chemical and scalpel. They should not go of the belief the body and its parts are essentially stupid. Now, this type of new ideas are coming, how the medical community can observe how the belief and the action are correlated. Now friends, finally I would like to say a brainstorming in John Hopkins Hospital. John Hopkins Hospital is in USA, a very famous hospital. Friends, Institute of Health in US in a survey found that 95,000 deaths occur per year in the United States due to medical errors. Due to medical errors. Though this information can be debated, this information was found to be very disturbing. It was recognized that the need for change in approach in Medicare to improve the safety and quality care to patients. In this connection, it was felt that it is important to train the doctors, nurses, paramedics, technicians, everyone connected with Medicare. Modern hospital is a very complex organization and there are challenges ahead to improve the safety of the patient. Quality Medicare is possible only when people work together as a team. Recently a seminar was conducted at Johns Hopkins where there was a brainstorming session, and I saw the CD between the doctors, Medicare personnel, patient and the relatives of the patient, which brought out all these factors very clearly. I would be very happy if our hospital conducts such type of review periodically in the combined meeting of doctors, nurses, paramedical staff and the patient's relative. I am telling this to the medical community because this type of integrated conference has been conducted after the occurrence of a tragic incident in Johns Hopkins Hospital. A child's life was lost because of judgment error in the diagnosis. The mother of the child briefed the whole incident to the combined gathering of the hospital team. It was a moving experience of the mother. There is a CD which my friend has sent to me from the Johns Hopkins Hospital. I would like to share with you, particularly while attending the cardiac patient in pre-operative, operative, post-operative and recovery period. Large number of sophisticated instruments and monitoring system are used. In this scenario, experience of treatment and the problem have to be shared together on a fixed days of the week and the results documented. It will become a teaching wealth for the cardiac care specialist. Now friends, in conclusion, I would like to share my experience with a chief monk. A monk, his name is Rinpoche. In Kathmandu, Nepal, he is a medical researcher. After nearly a kilometer walk, I reached the White Kumbha where the chief monk and his disciples were waiting to receive me few months back. After reception of the chief monk said, let us go to our study room, and I followed him. He climbed the first floor, it's a hilly region. He climbed the first floor, then the second floor, third floor, fourth floor and fifth floor just like a young boy. Probably the lifestyle has a positive impact on the mind and body. All along I was following and following. When I reached his chambers, I saw a laboratory, full-fledged laboratory and a spiritual environment overlooking the Himalayas. What surprised me was his research students come from a different part of the world. Particularly he introduced me to his co-author, Dr. David R. Slim, MD, who is working on a research area, medicine and compassion. The chief monk, Rinpoche, and myself exchanged few books. The monk has written with Dr. David Slim a book titled Medicine and Compassion. I like this book, a small book, and I read it during my journey from Kathmandu to Delhi. This book gives 6 important, that is medicine and compassion, gives 6 important virtues which a medical practitioner has to possess toward their patients. First virtue, according to him, is generosity. Generosity. The second virtue is pure ethics. Third is tolerance, because he is tolerance of the pain. Fourth is perseverance. Doctor never gives up. Fifth is the cultivating pure concentration on the patient. And the sixth virtue is to be intelligent. Continuously he is a learner. These virtues will empower the caregivers with human heart. I am sure the medical community assembled here practice all these 6 virtues as a habit while dealing with a needy patient, and this itself is a great example of synergy between mind and body and medicine. Now friends, I am in the midst of medical community. I would like to put forth a thought. What would you like to be remembered for? You know, there are millions of doctors in India. What you would like to be remembered for? You have to evolve yourself and shape your life. You should write it on a page. That page may be a very important page in the book of human history. And you will remember for creating that one page in the history of the nation, whether that page is the page of evolution of a new technological system, the page of innovation of way of working, or the page of creating an action-oriented mission for the people, or the page of triumphing over the diseases which have afflicted humanity for ages, or the page of contributing towards inclusive growth of the nation in time-bound manner. You can write to me. If you have got good ideas, write to me your views in my mail, apj@abdulkalam.com. I will correspond with you. My best with you. My best wishes to all of you members of IMA Meerut and all the medical students, success in their mission of providing quality and cost-effective health care. May God bless you all, friends. Now sorry I came a bit late, but it's not late for you. I can